KMET 1490 AM, KVVB TV, Channel 33. I'm Aaron Michael Sanchez with Mr. Brett on sports. And it's finally that time. Yes, I've been very excited about these next couple of interviews. Why? Well, I remember it just like it was literally yesterday. Jeff and I were talking. Jeff says, you know, he had all this really good information, all this really good. I'm like, you need to put this in a book. He goes, well, I want to put it in a book. I just need to find the time. So I gave him a little advice. Next thing I knew, he's like, hey, the book's coming out. And I'm like, wait, what? Yes, it's the Ultimate Health Bible. Super excited about this. Your guide to anti-aging, fat loss, and disease prevention. Joining us right now is Jeff Behar and John Tsikouris. Good morning. Welcome to the show, both of you.
Hey, thanks for having us.
Yeah, no, thanks for joining us. Now, for those that don't know, you guys know a lot about a lot. Jeff, let's start with you. You are, all I remember meeting you, I just remember seeing like basically a man built of rocks, and I thought, wow, you don't get those overnight. Talk to us about your career in bodybuilding.
Well, I started lifting at age 13 to prepare for football. Did my first bodybuilding competition when I went to Rutgers University for my undergraduate. And then after that, it kind of just took off and competed in USA and on the national level. But the idea for the book came because most of my family, in fact, all of my family has passed away from preventable diseases. So I shifted and retired from the bodybuilding stage after doing the Masters Nationals and the Freedom Legacy and winning the Masters California in 2017. So since then, John and I have been focusing on trying to get the word out to give people good information, not bro science, not bad information, but good information on anti-aging, fat loss, and disease prevention. It's really our mission to be able to improve people's lives.
Well, and I'm looking again, and John, it's good to meet you here. Jeff and I remember when Jeff was telling me just a little bit, it was a golden nugget, and I just thought, man, you need to put this into a book. When he approached you and said, hey, let's do this book, what were your first thoughts?
My thoughts were, you know, I wanted to get a lot of this information out there anyway, and me and Jeff were friends. And we talked about doing this, and when he said, hey, listen, let's do it, I was like, you know what, you're right. Let's put this information together. We know that people are going to benefit from this information. Let's get it out there, man. I think it's going to be really, really great, whether they're an amateur or there's somebody that's very seasoned. They're going to learn something from the book. We guarantee that for sure. With our knowledge to get put together, I mean, it was kind of like an unstoppable force. It was really, really great.
Well, and let's dive right into this book. What is something that somebody is going to come out of and say, whoa, I had no idea about that. I'm glad Jeff and his partner, John, put this together.
Well, I think there's a lot of good nuggets in this book. I think there's a key chapter that we feel to be directly helpful to people. It's a chapter on diagnostic testing. Diagnostic tests based by gender and your age on what you should be asking your health professional to test you for, so you can catch these potential disease markers early. And a lot of people, they die early or they have health problems because they haven't got the right diagnostic testing to identify problems before they get worse.
Interesting. And let's talk about especially the fat loss. What is it that people often do that is actually incorrect?
I think diet's one of them that Jeff covers in the book very, very well. You know, that's a big thing for people. And then I think at the other end of the spectrum that, you know, for weight loss, everybody wants weight loss, but they don't understand that hormones can play a big thing in this. And your general practitioners or your normal doctors are not running these certain kinds of tests to be able to get you at optimal levels for optimal results. So you're fighting, you know, you're doing the good diet, you're doing the exercise, you're getting the sleep, but your results are just not coming along, and people get discouraged, and that's when they stop. When there's really, you know, an underlying problem that they can really take care of, and this will expedite the results in effect. So it's a big thing for weight loss. There's a lot of different options out there, too. But what do you think, Jeff?
I'm sorry, John, go ahead. there's also some key things regarding eating and supplementation and things that can truly help facilitate fat loss so that while you're doing the same thing, you're actually burning more calories.
Well, and I remember that being a conversation because I think we were talking about what type of foods we to have, and I remember you saying, look, if you really work out, you work your muscles, it's going to burn a lot of that. And I remember though that you had a wealth of knowledge over there that how big is this book exactly?
It's 260 pages. It's scientifically based. Every statement made in this book about, for instance, if I say fish oil helps reduce body inflammation and helps increase the health of your heart, there's a recent reference to it. I think that's what's key about this book is you'll buy things that will have no references and you have to trust the author, or they'll have references that are old and not recent. So what John and I did with this book is we wanted to provide recent information, validated, that dispels myths and really information that you can count on.
That's right. If you're just joining us, you're listening to Jeff Behar and John Tsikouris. They wrote the book, The Ultimate Health Bible, Your Guide to Anti-Aging, Fat Loss, and Disease Prevention. Now, I'm going to just jump into this really quick question. When it comes to and they come to you and they say, look, because I've seen, Jeff, at least I've seen you transform other people's bodies pretty quick, pretty massively, by the way. And I remember thinking, wow, I wonder if he could do that for me. What is some of the first steps that you say to somebody to get them in the right mindset of even eating right?
Well, John is a personal trainer like myself as well, and he could chime in after I give you what I do. I first want to make sure that they truly want to lose weight and they want to look better. And I ask them if they can give me an hour a day and they follow my eating plan, which is not to keep them on a calorie deficit. It's just to clean up their food, eat the right foods at the right time, because that's another point in our book. Food timing is just as important as food quality and food amount. So if they are committed, I start off by doing an evaluation of their current eating habits. I make them do a log for 3 to 5 days, and then I build a custom diet, and then we get them on a workout program. John,
very good.
John,
and John, yourself?
Yes. Yeah. So, we've been around for 6 years. We've transformed everybody from your normal average day Joe to celebrities. Usually it's first just assessing the patient, making sure everything is good at optimal levels, and you can do that by blood testing because everybody can look a certain way on the outside. I've seen guys that look like Ferraris on the outside and Pinto engines on the inside. So it really does start from the inside out, right? So you can't tell until you really do that. So blood testing, I would say, at a certain age level, if you're 20 years old, you're probably not going to need hormone replacement, okay? So at that point, it's just getting the right supplementation, vitamin, amino acid, possibly injectables, and at that point, they can get what they need naturally without messing with the hormones. But if they're at a certain age, and let's say 30 and up, they should definitely do a hormone assessment as far as blood testing and a full assessment that we do. At that point, they can tell what's going on. And if there's a problem, they can fix it and put it to optimal levels. And that way, when they get their nutrition on point and they get their sleeping and they get their training like Jeff's talking about, they are going to have the full package and full spectrum. So at that point, they're going to be set up for success. And that's really where we break it down. We see what somebody is really trying to go after goal-wise, and our physicians and medical staff personalize the therapy programs for that. And in the book, we talk about that and kind of what you should be asking these doctors for. Doctors essentially work for you guys, all right? We're paying them. So at that point, they should be helping you. 5 minutes, 10 minutes, 15 minutes, turn and burn is not the way, and that's not how patient care should be. So, with us, it takes 30 to 45 minutes to really assess with the medical doctor, and that's going over their lab work, patient paperwork, family history, their health history, their goals, symptoms, and all that. So I think that's really starting because everybody's different. So really starting to assess them, what the problem is, and start hitting those problems.
Well, and I want to say maybe if you guys go with anybody, like you could one on each side, I'm pretty sure the doctor will say yes to whatever. Like, you just need to stand there because you both are massive beasts. And I want to say a big thank you for putting your brain down to paper, letting other people know exactly what they need to be doing in their life. It's all in the latest book. You can check it out online and in bookstores. The Ultimate Health Bible, your guide to anti-aging, fat loss, and disease prevention. Jeff, John, thank you so much for joining us here on the morning show. Thank you for putting this again to paper and for people to get, because I know you guys have been sitting on this and it's just about putting the time into it. Thank you for putting the time in. And where can we get more information if we want to follow you guys?
Well, first of all, the book is on Amazon and Barnes & Noble, but we want to also offer this deal that we got going. The book on Barnes & Noble right now, for hard copy, $21, shipped to your house, $15 from Amazon for the paperback. But more importantly, John and I have a special deal courtesy of Titan Medical Center. Go ahead, John.
Mm-hmm. Yeah, so basically what we're going to do is if you purchase a book and you show your proof of purchase, you can text it to us, email it to us, however you want. We're going to give you a free shirt or free leggings. So it's essentially going to be more than what you paid for the book. So you're essentially going to get one item for free, just doing that. And we guarantee that you're going to learn something out of that book, or I will buy the books back. I will personally put a guarantee out there. So at that point, you know it's going to be good. I mean, I can't back it better enough with a personal guarantee. So at that point, I'm very strong with that. They can follow us at Titan Medical Center on YouTube, Titan Medical Center on Facebook, Titan Medical on Instagram. Check us out, guys. We got all kinds of information on there. And Jeff, you can check him out in a whole bunch of different spots, right, Jeff?
Yeah, and if you order this book from Amazon this week, it will get to you before Christmas, and you can order it for people and have it gift wrapped.
Ah, there you go. That is, I mean, for some people, they'll be like, wait, what are you trying to say? And you're like, hey, if it means helping your life, or especially, none of us we all want to live a long time, but you ask anybody, your quality of life, you want it to be good too. This is where it starts. The Ultimate Health Bible. Thank you very much, Jeff and John, for joining us here on the morning show.
Thank you for having us. We appreciate it.
Absolutely. All right. So